concern is sweeping across parts of the United States. A rise in measles cases that health officials are calling one of the most significant outbreaks in recent years. Well, South Carolina has not reported any confirmed cases so far. The threat is very real, and experts now say it's time to stay alert and take action. So this morning we are breaking down how you can protect your family and why awareness is so key even here at home. This morning we have Dr. Tchamba with the Lexington Medical Center with all the details. Thank you so much for being here.
You're welcome.
Absolutely. Good morning. So let's go ahead and start by talking, how can a disease like measles, once was dormant, now being so active in the news right now? How does that work?
So it was never fully eradicated. It was eradicated maybe here, but it was still present in other countries of the world, in Africa, in developing nations, and even in Europe. So what happens then is that people travel. You know, the world has become kind of a global village, and you bring some of these diseases in other places.
So just to remind people, there are no cases here in South Carolina, which is definitely some good news to hear. But of course, to prevent that, as an expert, what should we be doing?
So we should be looking for signs. It is a viral, measles is a viral illness, so it's transmitted through respiratory droplets. So the signs you look for are initially cough, fevers, running. It looks just like a simple cold. So if you do have it, you may want to get checked.
Of course.
Yes.
Is there anything specific that the measles maybe might be like a red flag versus just a regular cough or some sniffles?
A rash. So in the early days of the infection, you'll notice a rash that usually starts along the hairline. But as the days go, it will spread to the rest of the torso.
Okay.
So you want to look for a rash.
Okay. What should they be doing for parents? Just watching out for those warning signs, and of course, the vaccine.
The vaccine. So the best way to prevent this is getting vaccinated. The vaccine is one of the more effective ones. The first, just one dose can give you up to 93% protection. You may still get the illness, like most people won't get it if they've been vaccinated. You may still get it, but you won't have the severe complications.
Definitely taking action now as soon as you see all of those signs and symptoms. Yes, well, thank you so much for stopping by this morning. Definitely a good insight into this measles outbreak. We've been hearing it all over the news, but again, just want to reiterate, there are no cases here in South Carolina, right?
Certainly. Fortunately, let's keep it so.
Yes, let's keep it that way. Well, thank you again. We appreciate you stopping by.
Thank you for the opportunity.
Absolutely. All righty, everyone. We're going to be putting this interview on our website later on today at WLTX.com.
Good Wednesday morning to you.